COVID-19 has changed many things in South Africa. Here, in the Greater Tsenin municipality of South Africa's northern Limpopo province, the mayor's voice comes from a drone in the sky warning about the potentially vital virus. With only 3 hospitals in the entire district, extensive coronavirus prevention efforts are needed.
Hey, what up? Hello, everybody. Alex Kapitko here on this kind of weekend catching up segment here on the Tonic Accord podcast. So, if you guys were watching on YouTube, you likely saw that video out of South Africa, which shows how a rural South African town has used drone technology to spread a message and awareness about COVID-19. And that's kind of what I want to talk about today is innovations when your back's against the wall. And Africa's really done a good job about kind of finding creative solutions to potentially long-term problems with COVID. And this is something that I've actually been working on. One of the jobs I do is I work with a think tank out of Africa, and we put together policy and blog papers. And I'm working on one right now about the lessons and setbacks in Africa involving COVID-19. And it's right now in the editorial phase, so it hasn't been published yet. But I just wanted to kind of get some ideas out about it. And, I've found it really interesting because obviously the entire world has been hit hellishly by COVID. But surprisingly, Africa's done better than a lot of early predictions have said. So usually in these catching ups, I've kind of been the negativity guy. I'm usually covering something like a slide into authoritarianism in Mexico or COVID lockdowns or, all that type of stuff. But today, I'm actually going to be Mr. Positivity, Mr. Rosy here. And I actually want to talk about innovative, creative solutions that actually could be important going forward in Africa, and I think most people thought at the beginning of this pandemic that Africa was going to get just devastated by COVID. And obviously, there is the asterisk that the economy is going to take a long time to recover because Africa's GDP has not done as well as people were hoping. But on the same thing, I'm actually optimistic to see that Africa's been creative and they actually haven't seen the amount of deaths that people were, expecting at the beginning. And there's a lot of reasons for that. Warm weather, younger population. I think those are definitely key. But a lot of people thought, bad infrastructure, ineffective governments, lack of transparency, fear. Those things would all kind of compile and make this pandemic awful in Africa. But actually, we've seen some cool stuff like that drone video you saw at the beginning. And just to kind of start this off, just in the numbers, and this is just a BBC article that highlights it well, they said through October, Africa's recorded approximately 37,000 deaths. While in the Americas, for example, 580,000 have died, 230,000 in Europe, and roughly 205,000 in Asia. So clearly that's a huge difference. And the case fatality ratio just isn't where the rest of the world is. And it's kind of fascinating. Like I said, I think it's mainly because Africa has a young population, which does help a lot. They have one of the youngest populations as a continent in the entire world, and that helps a lot. So I kind of have a theory about why at least there's been some innovative solutions coming out of Africa. And, a lot of the West, especially like Europe and the United States, and I guess you could say the Americas in general, have kind of used the same playbook, right? Like they have the infrastructure in order to have lockdowns, spending on their health programs, hospitals, etc. But in Africa, with the breakdown of supply chains, economic problems, and kind of lackluster infrastructure, I think it's kind of forced experts and scientists to take alternative solutions. And there's kind of 3 examples I want to use that I think highlight 3 different ways Africa's been able to do it. One is economic, 2 is science and technology, and the third one is politics and transparency, which is great to see it happening in Africa. So the first one is Rwanda basically adopting a nationwide digital currency, which actually helps people get money and be able to spend money during a time when there might be limits on paper currency and access to banks, that type of thing. So basically what happened in Rwanda is that the National Bank of Rwanda, which is the BNR, basically just removed charges on digital payments and currency. And this kind of expedited this already transition to digital currency. And this is kind of a big thing that's happening throughout Africa, just because there's not a lot of access to technology, infrastructure, ATMs, banks, like a lot of us in the West are just accustomed to. So digital currency is such a game changer in this part of the world. And basically, let me see here. I have it. So this increased the level of retail e-payments to GDP from 34.6% in 2019 to 54% in June 2020. So 54% of payments involving e-retail were all done online. And that's pretty cool. And the BNR, which is the bank in Rwanda, also found that there was a huge drop in the usage of counterfeit currencies as well, which has obviously been a huge problem in some of these countries. So it actually made people more honest, use more currency that's actually legal, and more buying power. Those are three things that I think are awesome. And it's going to be curious to see how this could be carried out nationally and if it's going to continue to be effective. But I think it's a start, and it does show that even in Rwanda, where they've had a lot of political, economic, ethnic tensions, they can still carry something out like this. Now, obviously, rural areas, it could be more difficult, involving access to internet, just technology, electricity, stuff like that. But it's a start, and also there needs to be faith in the nation's institutions, in their bank to do so. But it's a start, and I like to see that. And so, other than, rolling out digital currency, Rwanda's also been a crucial actor in this drone technology that I kind of mentioned in the intro. They've also been working on getting public broadcasts out to rural areas, which is really cool. And I think it's a great way to get better connectivity inside of a nation, especially when you have these rural areas and these ethnic divides. I think that's something that really could have long-term connectivity and just infrastructure effects inside of some of these countries. Also, countries like Ghana have actually even gone a step further, and they've been using drones for COVID testing and tracing. They've used a mixture of zip lines and drones to do so. And I've even seen reports that the United States is working on reverse engineering some of these drones to figure out how to do it. Because let's be honest, in a time where you really don't want to be that close to people, you don't want physical contact, drones could literally be a game changer. And so, let's see, UNICEF here has an article titled How Drones Can Be Used to Combat COVID-19. And it basically just talks about how this could be a step in limiting face-to-face contact and helping connectivity in areas that maybe don't have good infrastructure. So I think that's really cool to see. Obviously, there's a long way ahead of this, but right now, from what I'm seeing, 18 countries inside of sub-Saharan Africa have deployed some form of drone technology to fight COVID. And, this is something that down the road could also help with malaria, other diseases, messaging during a time of chaos, conflict. There are just so many practical methods in which drone technology could help Africa, especially countries with lower infrastructure and more rural areas. And so this is just a brief little video that I'm just going to put on for a quick moment, but for those who are not watching, it is just this company in Ghana that is using drones to deliver COVID tests and other supplies to rural areas. So let's just take a look, because it's kind of cool, honestly. And yeah, it'll be interesting to kind of see maybe how this drone technology can progress in places that could really use it. And like I said at the beginning, this is just kind of a brief episode, so I'm going to keep moving. But another interesting kind of innovation, I don't want to say it's an innovation, but positive of African response is that actually some governments have been quite transparent and effective in handling the pandemic so far. And Senegal is an example of that. And they're kind of a surprising case, actually, because the Global Health Security Index feared that Senegal was one of the least prepared countries in the world to handle a pandemic. And that's because of poor infrastructure, inadequate health care, and just crowded cities and a lot of rural areas that are isolated. And it's actually kind of interesting because in a piece called Localized Community Plans Help Senegal Control COVID-19 from the Brookings Institute, they basically talk about how the country's case numbers remain some of the lowest per capita in the world. And they basically argue that this is because of a quick response, government transparency, and a pretty adequate mobilization of resources. The article talks about how following the first case, the government enacted several public health policies to prevent community transmission. That's something that even Western countries were slow to do, politicization or whatnot. And also, they are credited in providing transparent and consistent messaging from the start. And that's probably the key. And Foreign Policy magazine actually ranked Senegal's pandemic response second out of the 36 governments it examined. Second out of 36. And that's insane because remember, this Global Health Security Index at the beginning talked about how they were one of the least prepared to handle the pandemic. And another interesting side effect is that the government wasn't only honest and transparent, but researchers inside of Senegal also developed an immune-based diagnostic test. and it's around $1 for a test, so it's actually affordable inside of Senegal. And it's been remarkable of how basically the public and the private sector have managed a crisis inside of a country that really wasn't ready for it. And I think in general, that's kind of the broad picture here, is that you don't need a bunch of money and a bunch of infrastructure. You need creativity and a willingness to do something. So while there's so many great innovations, my one fear is that the way COVID is uprooting people's lives and changing our daily habits, it actually could exacerbate an old problem, which is malaria. And there's a great Economist article about Kenya and basically how urban dwellers are sending their kids and relatives to the countryside. Because in the countryside, kids can go to school and get food provided with their education, and everything's cheaper. So, as the economy gets worse, urban dwellers are like, you know what, we can't afford to keep all of our family here, so let's send them somewhere cheaper. And that makes sense, obviously, too, for safety reasons, because COVID flourishes in populated areas just because of its spread and transmission issues. But, the other side of the coin, and I don't mean to smile there, but the other side of the coin is that malaria flourishes in rural areas. There's a lot of irrigation ditches in rural Kenya where these mosquitoes that carry malaria flourish. So basically, the tragic irony here is that these families have gone to the countryside to avoid COVID, and instead they've found a disease that actually is more dangerous for children. So the Economist mentions a really interesting point, and I'm just going to go in the quotes here, is that they say that worldwide 400,000 people have died of malaria in 2018. 2/3 of them are children under 5. Very few children died of COVID-19. So this could lead to a situation basically where adults are infected by COVID and their children with malaria. And to make it even worse, because of COVID, the economic and just political responses and chaos, countries like Kenya have actually had to scale back their malaria testing and their ability to get bed-treated nets and other things for people with malaria. So, COVID is uprooting people's lives, and it actually could make malaria worse. And yeah, the factors of COVID pushing some people to rural areas might be contributing to what the World Health Organization calls the worst-case scenario, in which they talk about how the death toll of malaria in sub-Saharan Africa could double in 2020 to almost 800,000 people. Not good news. So I'm not highlighting this to be negative. I mean, because there's a lot of positives in terms of infrastructure, innovation, technology, and maybe effective government. I've always been a proponent of trade unions and continental unions, kind of like the European Union or NATO or NAFTA, right? I'm a big union guy. And I almost feel like the African Union, which is still kind of in its infancy, or let's say it's in elementary school now, if it could get more involved, I almost think some of these solutions could become not just Kenyan or Senegali, but African. And that's where I see the positives coming, is that there are a lot of ideas. There's a lot of smart young people that really want to help the continent get better. But we do have to remember that there are old problems and COVID's not going to get rid of them. So take care, have a great weekend, and we'll see you guys next week with some fun episodes. Take care.